my name is Angelica. I'm a registered nurse. I'll be doing a head-to-toe assessment today on my lovely, very patient volunteer, also known as my mom, who was very kind to let me practice on them and to allow me to do my assessment on her. Now, the purpose of this assessment is to demonstrate a thorough physical exam, the kind that we would normally perform on patients to check the patient's overall health and to catch anything that we may need to follow up. Before we get started, I've already washed my hands and made sure I have everything that I need and confirmed the patient's identity, but for the purpose of this video, I'm going to go ahead and restart the scenario. I've also printed out my checklist, which I'm going to note take everything the patient lets me know and jot down.
Hello, come in.
Hello, how are you?
I'm fine. How are you?
I'm good. I'm Nurse Angelica. How are you?
I'm good.
Everyone calls me Nurse Angelica or Jelly, so either one, Nurse Jelly is
Nurse Jelly.
Okay. So I'm going to be a nurse today, and I'm actually going to be doing a head-to-toe assessment. Is that okay with you?
Yeah, that's okay. It's a good time. Yes.
Okay, awesome. Now, before I get started, I'm just going to go ahead and wash my hands, and then I'll be back with you shortly, okay?
Okay.
Awesome. All right, Miss Robinson. Now, before we get started, may I have your first and last name, please?
D. Robinson.
D. Robinson. And your date of birth?
September 23rd, 57.
September? I was born September as well. That
Oh.
makes you 23rd Libra?
Libra. I'm in the cusp.
I'm Virgo.
Virgo, Libra.
Virgo, Libra. You want to be a Virgo so bad. Okay. Do you know what year we're in?
Yes, absolutely. 2025.
You sure?
I'm absolutely sure about that.
Okay. Do you know what president we have?
President Donald Trump.
Donald Trump. Okay, awesome. And do you know what month we're in?
Yes. June 29th.
Okay. Perfect. Awesome. Okay. Now, before we actually get started with the actual head-to-toe assessment, how have you been feeling? Are there any concerns that you want to mention before we get started?
No, I've been fine.
Everything's okay with you?
Yeah, except for a little itching on my back.
Little itching on your back? Okay. I will notate that here in our skin section. Okay. All right, so I'm going to go ahead and get your vitals started.
Okay.
Place my gloves on. Okay. And I mean, what brings you in today?
No, it's like I told you.
Just the itching in the back. It's,
Itching.
that must be really extreme, huh? Okay. Temperature's good. I'm gonna go ahead and place this pulse ox on you. And if you don't mind, only if you're comfortable, when we start with the actual head to toe, I'm going to ask that you just sit on the edge of the bed, okay?
Okay, can do that.
Okay, awesome. Thank you. Let's see, this is a little too big for you. I'll see if the nurse secretary could go ahead and get a smaller one for you, okay?
Okay.
Let me see. 98. Perfect. Let me just jot that down. And I don't mean to turn my back, okay? It's just I just want to jot that. Okay. Thank you. So do you have any plans for your birthday yet?
No.
No, nothing yet. I actually wanted to, well, I'm not gonna let you talk. But I wanted to go on a cruise with my mom, but unfortunately, I'm having car trouble. And it looks like I'm gonna have to get a new car now, so those plans are different. But we still have a little time to figure that out. Okay.
High.
It is pretty high, but I do see in your chart that you take blood pressure medicine, right? Correct? You take blood pressure medicine,
Yes.
right? Okay. Now, I'm going to go ahead and let's go ahead and get you seated to the edge of the bed for me. Okay. Awesome. Thank you, thank you, thank you. Okay, so we're gonna go ahead and start with your head. I just want to inspect to see if I feel any lumps or anything, any masses, which I don't. No lumps, no abnormalities. And your hair is evenly distributed for your age. Okay. Any tenderness?
No.
All right, no swelling noted. Okay. Awesome. Okay, could you look at me? I'm gonna check your face for symmetrical, which it shows. Can you take your glasses off for me, please? Okay. So I show your facial features are symmetrical. No drooping, no swelling, no discoloration noted. Awesome. Can you smile for me? Thank you. Just give me 1 second. All right. I'm going to have you smile for me. Thank you. Can you make a frown? Okay. Puff those cheeks of yours for me. Any difficulties doing that?
No.
Okay. And that's a good thing. It shows that your cranial nerve 7 is intact. Perfect. Now, I have my pen light here. And I'm going to check your eyes, okay?
Okay.
I do already see that your sclera is white, which shows good. Now follow this for me.
Okay.
I'm going to check the movement of your eyes, okay?
Okay.
Now don't move your head. Just follow with your eyes.
Okay.
Awesome. Perfect. Don't move your head. Don't move your head. Thank you. Perfect. Perfect, perfect, perfect. Thank you. And I do show that your conjunctiva is pink and moist. Now this light is going to be a little bright, okay?
Okay.
Let me know if you do feel anything, if there are any issues. Okay, awesome. So your pupils do show equal, round, and reactive to light and accommodation. And once we did do the pin movement, your extraocular movements are intact, which shows your cranial nerves 3, 4, and 6 are functioning properly.
So I can put my glasses on?
You can most definitely put your glasses on.
Need those.
So you can't see without them, huh?
See without them.
Are you nearsighted or are you farsighted?
Nearsighted.
Farsighted? Oh. I wear glasses. I have astigmatism in one eye. You know what that means? It's a little blurry for me at night or when it rains and everything.
Well,
like
everything is blurry for me.
Oh my gosh, I can't imagine. Well, I can, because I hate it. I actually hate it. So now I'm going to check your ears. Do you have any problem hearing?
No.
Okay. I don't know any drainage.
No. No.
And I also don't feel any tenderness.
No. It's good.
Okay. Your ears are symmetrical with no lesions or discharge. There was no tenderness or palpitation. Now I'm going to note how your hearing is. I'm going to whisper something in both ears, and I'm going to ask that you repeat it for me, okay?
Okay. Queen is my name.
Okay.
I am the all-time queen.
Oh, who is this queen person?
It's me. That's the name my daddy gave me.
Oh,
I was special.
okay. I think one of your children told me that. Awesome. Your hearing is intact bilaterally via the whisper test, so that's awesome. Yeah, so far so good. For your age, it looks like you keep yourself pretty good. I want to be like you when I grow up.
Just take care of your body.
Okay, good. Now next we're going to go ahead and we're going to go down to your nose. We're going to do a smell test. We're going to do a few tests here now, okay? So I'm just going to inspect to see for
Well, I
symmetry.
can smell now.
You can smell.
That's my children.
Oh. I don't think I wanted you as my mama growing up. You seem pretty strict. So I'm just going to check for symmetry and any lesions, okay?
Okay.
All right. And I'm going to check your sputum, okay? To make sure it's not deviated or anything.
Septum.
Your septum, okay? All right. Which it isn't. Your nose is midline. There's no discharge noted. No deviation. I'm going to have you smell two different things here, okay? And you let me know what it is that you smell.
That's Vicks.
Vicks?
Mm-hmm.
Are you sure?
Yes, mentholatum. Vicks.
Okay. All right. Now, Miss Queen. What about this? Is that sweet?
It's a color perfume.
Perfume. Awesome. Awesome. So your nasal passages are patent bilaterally. Perfect. All right. So now we're going to go ahead and move on to your mouth. Could you stick your tongue out for me, please? Ah.
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 All right. I see. Move your tongue to the left. Move it to the right. Lift it up. Lift it down. Say cheese.
Cheese.
Awesome, awesome, awesome. Your lips are pink and moist. Do you wear lip gloss or something? I don't see any cracks or lesions. Your teeth are clean. Gums are pink. No bleeding. I see that there's no coating, no yeast or candida on your tongue, which is perfect. That's actually pretty good. And your cranial nerve 9 and 10 are intact, so that shows that, okay? Now I am going to go ahead now and check your neck area. I do want to inspect your trachea, which should be midline. I want to palpate your lymph nodes.
Okay.
Okay. And I do want to check for your jugular vein distension.
Okay.
Okay, that's not going to be any issues with that. And we're going to...
That's not going to hurt, is it?
No, it shouldn't hurt. Not at all. And I'm going to check your carotid pulses, okay? My hands may be a little cold.
Okay.
All right. Any tenderness? You feel any pain? Okay. I don't feel any swelling of the lymph nodes. Check your TMJ. Open, close, open, close. Okay. I'm checking your carotid pulses, which are present bilaterally, 2+. Okay. Equal bilateral, 2+ in strength. Your trachea is midline with no visible swelling or masses. Listen, I need your secret, okay? I need your secret, Miss Robinson. We still have quite more to do, but we're getting along, okay?
Okay.
All right. So now we have made it so far to the respiratory part of the head to toe assessment. I'm going to inspect your chest, the shape and symmetry of your expansion. And I'm going to go ahead and also take the anterior and posterior. So that's the front and back of your chest, okay? All right. I'm going to have you take deep breaths for me. Take a deep breath in and out. Again for me. Thank you. One more time. Can you do it again? Deep breath in and out. In and out. Okay. Can you lift your head up for me? Let's see. Okay. All right. Is it okay if you just lift your shirt up just a little bit for me? Slightly. Thank you. Okay. Okay. All right. So your chest is symmetrical, and I do see with your breathing it rises and falls during respiration. And you didn't have any signs of respiratory distress, okay?
I'm good.
Yeah. Mm-hmm. Have you ever smoked?
Oh, no.
Oh. Okay. Good. Nowadays, that's all you hear. And your breath sounds are clear in all lung fills. I didn't hear or note any wheezes, crackings, or bronchi noted. Now we're going to move on to your cardiovascular. We're going to start with your aortic, your pulmonic, Erb's point, and the tricuspid, and then lastly mitral. So it's going to go, basically I'm going to show you on myself. We're going to start here, and then we're going to go kind of down. So I am going to go like around your breast area, okay? And end over kind of to the side. That's fine?
Yeah, that's fine.
Okay. Okay. I hear your heartbeat, no irregular sounds. Okay. S1 and S2 pulses are strong. I'm sorry. I'm all in your business. I'm sorry. And then my hands are cold. Okay, Ms. Robinson. Like I stated before, S1 and S2 are heard clearly with regular rhythm. Okay. I want to go ahead and check your capillary yes. It should be 3 seconds or less. And this just lets me know your blood flow to the heart is perfect. All right, your peripheral pulses are strong and equal bilaterally as well. Okay, now for this part of the head to toe assessment, I am going to ask that you lay flat. I do want to, it's going to be inspecting your abdomen, okay?
Okay.
So the first thing first is I'm going to have you lie flat.
Is this flat enough?
Yeah, this is flat enough. Now, I am going to have to expose your stomach a little bit.
That's okay.
Okay. And then I'm going to inspect first. Just look. I'm not going to touch. Okay? Yeah, I'm going to inspect, auscultate. Right. And I actually do see abdomen is flat. No distended, roundness, or anything noted. Okay. I don't see any scars. Have you had a C-section before?
I had a C-section and I had my appendix out when I was 17.
Appendix out when you were 17. 17 appendix, C-section. Okay. I don't see any visible movement or any palpation, pulsation. Okay. All right. So upon inspection, your abdomen appears flat with no visible lesions or abnormalities. Now I'm going to go ahead and auscultate. I'm just going to listen to your stomach, okay? If you did not know, we have 4 quadrants of our stomach.
Okay.
Okay. And I'm going to go ahead and start with the lower right quadrant and go clockwise, all right?
Okay.
And I'm just listening for bowel sounds, okay?
Okay.
When was the last time you ate something?
About an hour ago.
Oh, Miss Ma'ams, you got a belly button ring.
Yeah.
Oh.
I've had that over 20 years now.
20 years.
I was 43 when I put it there.
Oh my gosh. 43.
It's my freedom ring.
Oh, your freedom. Listen, I want to be like you when I grow up. You're being called queen. You're getting belly button rings. Listen. Okay. All right. So bowel sounds are present in no more active in all 4 quadrants. I'm going to go ahead and percuss. Okay. Now I was just listening for any air fills or to see if there's any dullness, okay? And I didn't hear any dullness. So percussion revealed throughout the abdomen, no abnormal dullness was noted, all right? Lastly, I'm going to go ahead and palpate. It's going to be from a light to a more deeper touch, okay? I'm just going to be feeling for any masses or any organ abnormalities or if I could feel anything, okay? So it's going to be a light touch at first. Do you feel any pains?
No.
And may I ask, when was the last time you had a bowel movement?
This morning.
And do you go regularly?
Yes.
That's pretty good. I try to go regularly. I've actually been eating chia seeds a lot lately. I hear that's a very good high source of fiber. Okay. Miss Robinson, you're my model to go to when I get older. All right, abdomen is soft, non-tender to light and deep palpation. No masses and no guarding observed, all right? Okay. Now, you seem pretty good. You seem pretty active. So, I don't even think I should have to ask you this question. Are you having any incontinence issues or anything like that? No. All right, so we're just going to go ahead and skip that. I'll note here, no visible skin breakdown. And I don't even have to, you don't have any issues with urination or incontinence. Now, I'm going to ask if you can go ahead, please, and sit to the side of the bed. I want to check your little skeletal extremities. Okay? We're going to do arms and legs, okay? All right. So, I'm going to press down, and you try to get up. All right. Perfect. Now, you're going to push Push, 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 push. Okay. Now pull. All right, all right. Your muscle strength is kind of 5 out of 5. Okay. All right, so push down. I'm gonna try to, okay. All right. Perfect. Now, okay. You want to push down. All right. And you have full range of motion. Do you exercise?
Yes.
I don't even think that's a question. I don't think that's a question for you. Okay. So while I'm down here, I'm going to try and check your legs. Is it okay if I take your socks off?
Yes.
Okay. Alrighty. I'm just checking to see if there's any swelling or any edema in the lower extremities. And I'm going to check your pedal pulses, okay? All right. They're good. And there's no edema, no swelling, no redness, nothing in your joints. Let me check your knee. And well, I need my...
Stethoscope. You can use the stethoscope.
Okay. Alrighty. Okay. Awesome, awesome, awesome. Miss Robinson, let me put these socks back on for
yes,
you.
please.
Oh, someone likes their socks. You get cold a lot?
My feet. If my feet are cold, I'm cold.
Oh, you're one of those. And then you did mention to me about your lower back, right?
Yes.
Okay. Let me. All right. Now, before I have you lay down, I'm just going to ask that you stand up for me. And I want you to just walk so I can check your gait. Okay. Awesome. Can you go back to the bed for me? Okay. All right. You can have a seat. Okay. So, where is this rash that you were mentioning to me?
My back.
On your back? Do you want to show me? Okay. So I do see here that we have a rash, and I'm going to notate it to see what we can get from the doctor.
Okay.
How long have you noticed
About
this?
a week. It's about a week. I think I have very sensitive skin, and I put on a girdle.
Okay.
And
Maybe the latex in the girdle?
Maybe the latex in the girdle caused it.
But have you ever been allergic to latex?
Not to my knowledge.
Oh.
But anything like that will give me a rash.
Okay.
I have sensitive skin.
Okay.
Skin is very sensitive.
Okay. All right, let me just check your skin color, because other than that, your skin in the area is good. I just want to check your skin turgor, which is good. And I'm going to check your nail for clubbing or cyanosis, which is none noted. Skin is warm, dry, and intact throughout. Now, I cannot state that you don't have any rashes only because you have that on your back. But throughout, everywhere else throughout your body is intact. So I'm going to put that. Your nail beds are pink. No clubbing or cyanosis. And like I stated earlier, your cap refills are less than 3 seconds. And then, are there any questions that you have for me?
No questions. But you said you was going to talk to the doctor about
Yeah, because like
maybe
I
a
said,
cream.
a cream.
I
Do you
had
use anything over the counter?
no, but I had a prescription for a rash for the same rash, but it was more like a year ago that I got it, and the doctor gave me that, so I've been using that because
But it's almost done.
yeah,
Okay. And this works in the past for you
it worked
before.
in the past for me.
Okay.
So she told me to keep it to in case I have another flare up.
All right, Miss Robinson. So I want to thank you so much for being such an amazing patient and being so cooperative with me. I think we did very well with this head to toe assessment. And besides the rash that we had, you seem to be very well, very,
I'm good.
yeah,
I'm pretty healthy.
alert and oriented. You're good.
Mm-hmm.
And like I said, I want to be like you when I grow up.
Mhm.
Belly button ring and all. Belly button ring and all.
Okay.
So if there's anything that I need to get you, a cup of water, a cup of ice.
I know I'm fine.
You good for today?
I'm good for today.
All right.
Yeah.
Thank you so much. And if you need me, just call the call light, okay?
I'll
We'll
call
try to
you.
help you in any best way that we can.
Okay.
All right. Thank you, Miss Robinson.
You're welcome.
Now,
You may have to do it.
all right, that wraps up my head to toe assessment. Thank you to my amazing patient for being so cooperative. As always, of course, if we were in a clinical setting, I would document all of my findings, report any abnormalities to the provider, and make sure that the patient was comfortable before leaving the room. Thanks for watching and enjoy the rest of your day.